Hello, I'm Kamal Kabaz, Chief of Cardiac Surgery at the Beth Israel Deaconess Medical Center. I would like to take a few moments to tell you about our exceptional team of professionals at the CardioVascular Institute. We are passionate about delivering outstanding heart care, and we do that across the spectrum of cardiac disease. Our surgeons are experienced in both minimally invasive and traditional open surgical techniques. Our cardiac surgery practice is one of the largest in Boston, and it's growing rapidly. More important to you and your loved ones are outcomes, and ours are among the best in the nation. We work closely with cardiologists and vascular surgeons from across the CardioVascular Institute, which allows us to provide you with comprehensive care and seamless service.
I'd always thought of myself as in good health, walk 5 miles a day for fun, some days more, until one morning about 5 weeks ago I woke up with a heart attack. And the ambulance folks took me off to my local suburban hospital where I was stabilized and looked at and deemed that what I needed was cardiac catheterization to figure out what was really going on with me.
Overall purpose for our patients when they come to the clinic is to determine whether they need cardiac surgery or not. If we've determined that you need cardiac surgery, the ball starts rolling here.
Before you enter the operating room, we would know everything about your heart condition that we need to know in order to perform a successful operation. As you know, surgeons do not like surprises. And we know all the results of your angiograms, your CT scans, your blood tests, your echocardiograms, and many more other tests before we make our first incision in the operating room.
We try to get your pre-admission testing done the same day. There's several tests that are needed. Those tests are chest x-ray, blood work, anesthesia consent, EKG. Sometimes carotid studies and vein mapping are needed.
Everybody I worked with here managed somehow to come by and introduce himself or herself first, so that by the time we were actually talking about anything specific that was going to happen to me, it was somebody I'd met.
We try to schedule surgery before you leave the office. We give you a date depending on the availability of your surgeon. We send you to your pre-admission testing. Within 30 days, we give you a date. Our administrative assistants in the office will send you all the paperwork that you need. If the date isn't good enough for you or your family, you're welcome to call us. We'll set up a date, whatever's convenient for you.
May I have your last name?
When you arrive, you will come to the West Clinical Center and you will check in at the front desk. One of our ambassadors will bring you up to the 5th floor where you will get ready for your surgery. Your family will wait downstairs until we're ready for them, and then they will come up shortly afterwards.
I think at this point there was momentum. Hey, we're on our way, this is actually going to happen. The uncertainty is going to be gone.
Not only will the holding area nurses be doing their, getting information from you, but you'll meet the operating room nurses. You'll meet at least two of the anesthesiologists who specialize in cardiac surgery. You'll meet the physician's assistants, if you hadn't already met them, that work on the cardiac team, as well as the cardiac surgeon and the support staff.
We'll put a camera in this office. It allows us to see better.
Some nurses, I don't remember how many, came by and introduced themselves. It felt not at all insecure.
So you'll probably end up seeing probably 6, 7 people that will come to meet you and probably ask you a lot of the same questions, but we all make sure we're on the same page and that we take good care of you. Sometimes if you are scheduled for the second case and the first case goes longer, that you may be delayed on the second surgery of the day. Once they are all set with you in the holding area, your family can wait with you until you go into surgery. They're very important to us, and we want to make sure that they're there for you as your support system. After you go into surgery, they'll be waiting for you up on the 7th floor in the cardiac ICU waiting area.
For me, it was, okay, this is what we're going to do. I'm in the hands of people who've gotten to be at the top of one of the major hospitals in Boston. They must be good.
Cardiac surgery is a team sport, and it's not just about the surgeon. We have a number of people working with us inside and outside the operating room. Inside the operating room, we have an expert team of anesthesiologists, nurse anesthetists, scrub nurses, circulating nurses, perfusionists who run the heart-lung machine, 420, sir. Physician assistants and nurse practitioners, and our residents and fellows in training for cardiac surgery. So heart surgery requires extensive monitoring. We use special intravenous lines and special catheters to monitor your heart pressure, for example, your lung pressures. We use echocardiography, a heart-lung machine that would allow us to go on bypass and bypass your circulation, your heart and your lungs, so that we can perform heart surgery, and many more other things that differentiate heart surgery from other operations, for example.
I'm out.
Thank you.
It was in the coronary ICU that I opened my eyes, and there were two extremely capable nurses looking over me. And I remember thinking, oh, I'm here. Isn't that nice?
Probably your first memory here in the ICU will be when you just start to wake up from your surgery. You'll still have a breathing tube in. It's not necessarily the most comfortable feeling, so some people find it a little bit of anxiety producing. We'll do everything we can to make you comfortable. That feeling should only last for a few minutes, and then we'll have that breathing tube out.
From then on to the next morning was just an experience of the best possible care one could have.
Besides the surgeons, we have intensivists who are also physicians that specialize in critical care medicine. We have physician's assistants and nurse practitioners, which we generally refer to as mid-levels. They'll be the crux of your caregiver while you're here in the hospital. You'll interact with them on a daily basis, and then we have a superb team of nurses, and they will provide the minute-to-minute care both here in the ICU and down on the step-down floor.
Said, can you take a few steps? And I took a few steps, and other than the unfamiliarity of walking around connected to all these utility wires and cable TV and such, it felt very, very straightforward, very normal.
Now we have a pathway that's on everybody's door so that they can look and see what the typical time frame is for each activity that we have in the ICU, be it getting the big IV out of your neck, or the chest tubes out, or the pacing wires, or getting out of bed and walking. All those things can happen both in the ICU and down on the floor.
According to our pathway, on post-op day 1, the morning after surgery, you will get into a chair with your nurse in the cardiovascular intensive care unit, which I'll refer to as the CVICU, and you will be rolled downstairs to FAR 6 by your nurse, where there will be a handoff with you and with the nurse from FAR 6 and from the CVICU, going over where you're at in your recovery and the plan of care. On post-op day 1, when you come from the CVICU, you will still have tubes and wires. As we remove all these tubes and wires, we will also be helping you to increase your mobility. We will be walking with you several times a day, working towards post-op day 3 and 4, where you will be walking independently. Our physical therapist will assess you probably on post-op day 3 to help us make the best determination on your discharge plan.
We did some walking together. She assessed what happened to me when I walked up and down stairs, and she told me what I might expect my limitations would be, and also made up for me an exercise schedule.
We also will have you attend a class.
I'm going to talk to you this morning about your recovery.
I attended the 1-hour session for, I think it was called discharge prep class or something similar. I think I mentioned that this was clearly a partnership. There was no time along the way when I didn't feel like one of the partners.
Some of this is discharge information we give to everyone, and then there'll be personalized discharge information with all your medications written out in a medication grid so that you know exactly what medications you're supposed to take and when. When you go home, we will give you part of your medical record to take home. This is a flash drive which fits on a USB port on any computer, and on it we will load part of your medical record, your operative report, your discharge summary, your EKG, your chest x-ray. We will send this information automatically to your primary care provider and to your cardiologist, but this flash drive will give you a copy as well.
The folks who worked on me are a team who could teach a symphony orchestra how to work together. And I can't imagine myself having gotten better care than I got here.